Muy buenos días. Mi nombre es Dr. Akbar Khan, médico residente de segundo año en medicina interna, aquí en Hospital Municipal de San Juan en Centro Médico. Today, I would like to thank the Puerto Rican Public Health Summit 2022 for allowing me to share our work. It is very exciting to work with like-minded individuals and the opportunity to share and the opportunity to work towards a better Puerto Rico. Now, my paper is based on a very important and relevant topic called vaccine hesitancy. But before we start, I would just like to say that we must take a moment and admit that immunizations is one of the greatest public health achievements in protecting humankind from deadly diseases, saving millions of lives every year. And despite knowing this, a high resistance to being vaccinated is starting to become apparent in our societies, especially here in Puerto Rico. So our paper went out to figure out what is causing people to have this sort of hesitancy, this unwillingness to become vaccinated. Now, when we discuss and describe vaccine hesitancy, we must first define it. Defining vaccine hesitancy by the World Health Organization Working Group as a delay in acceptance or refusal of vaccination despite availability of vaccination services. And this has become increasingly noticed in the news these days, especially with the COVID-19 pandemic. So what we did here in our hospital in Municipal de San Juan during our vaccination services, we created a 26-item questionnaire, which was with comprehensive literature review and based on expert suggestions with the San Juan City Hospital Internal Medicine Residency Program. So during this questionnaire, we were able to extract a lot of information for which I will be sharing a few of it here. Now, when we think about vaccine hesitancy, something that's very odd is that the vaccine hesitancy nations, which are industrialized like Puerto Rico and the USA, tend to have more reluctance to become vaccinated, whereas one would think that in countries that are less fortunate and have less income would have less vaccination. But it's reversed. It's the industrialized, working, rich nations that are having issues with becoming vaccinated. So in summary of our results, I have two graphics here that I'd like to share, which the orange part shows no in the first graphic up here, saying that we had no conversation with our primary care physicians. There was no conversation with healthcare professionals. And people are assuming that they know everything about the vaccines. That was one very standout result. And below that on the second graph, we have people again confirming, did you speak to a primary care physician? Did you speak to a health professional? Where did you get your information? And during our data collecting and gathering, we found out that there was basically no contact with the communities and health officials. So this is where I come in, and my thinking and thought process was, how can we reach out to those people in those communities who need our help to deliver high quality, up-to-date medical information, listening to those people and responding to them? That is where I came up with the idea of the creation of a coalition of resident physicians across Puerto Rico to deliver this high quality evidence-based medical information face to face to rebuild the public trust with the scientific community. In short, I would like you guys to take a picture with the QR code of this graphic down here and just look at the up-to-date statistics of Puerto Rico. We are blessed that we are up there in ranking on how many people are fully vaccinated, pero falta mucho. And I want to collaborate with my like-minded individuals here in the Puerto Rico Public Health Summit and try and figure out how we can increase vaccination acceptance rates. I appreciate your time. Thank you for listening, and I wish Puerto Rico the best. Vamos pa'lante.